A good evening to our participants. We will give ourselves 5 minutes and then begin our session. Karibuni. So good evening, colleagues. This is our second webinar of the year. We had taken a break for a while, but now we are glad to be back. Happy New Year to you all. I hope we've been doing okay. So today we are going to have, as I had mentioned, our second webinar of the year, and it's on self-care. Our speaker today is Professor Muthoni Maathai. She is a psychiatrist, she's a lecturer, a clinician, and a researcher. And for fun, she loves to do mountain climbing. She loves to bird watch. She takes photographs of nature, or is it nature photography? And she loves reading as well. So without further ado, we will welcome our speaker to be able to take us through the topic. Karibu sana daktari.
Thank you. Thank you very much, Dr. Ohas. And this is, I would just want to repeat this because maybe some of you attended the KPA webinar on Thursday. This is a repetition, and so it's just like for a different audience or for a wider audience. So let me just share my screen so that I can get my presentation going. Good evening, everyone. I should have greeted you first. Sorry about that. Colleagues. So let me put it in presentation mode. So we're really going to talk about anxiety, psychological stress, cultivating positive coping strategies, and this was a kind of webinar we developed during the height of COVID-19, and that's why still in COVID-19, it's still important to think about the kind of stress we were going through at that time. It still continues. So the objective of the presentation is to remind us that we as mental health providers owe it to ourselves to provide a mental health to ourselves. And this is one of the things, sometimes you look at things and you say they're so bad, and then you say, there's one positive thing that what COVID-19 has helped us to look at ourselves and to say, hey, we need to take care of ourselves. Self-care is important for us. So my challenge to you to start the year 2022, which is now in February, ensure we set aside time for self-care. Think about self-care. Think about taking care of yourself, and set aside some time to do something for yourself. We spend a lot of time taking care of others, and sometimes we forget ourselves. So now this is just a brief introduction about the COVID-19 situation, January 30th, 2020, when it was declared a public health emergency of international concern by WHO. That's an important point. And of course, we all thought it was going to be short-lived. We've just gone through a very, a spike, another surge, sort of like one of the biggest in November, December, totally unexpected. And every time we think it's over, something new comes up. So we are fighting through different variants. And a lot of people did get sick in November, December. And the hospitals were not so overwhelmed. Most people could be managed from at home, which is a good thing, because in 2020 and part of 2021, our systems got very, very overwhelmed. Okay, so we've lost a lot of friends, relatives along the way. In Kenya, we've had 565 deaths as of January. Those are the ones that were documented as, we don't know about the non-documented ones, and we're still counting. And so my take on this is, every time, every day, we have a reason to be grateful that we are well, that we have survived individually, and even as we mourn and miss those we have lost. And I put this in the other webinar on Thursday as well, because, and I know there are lots of psychologists here, and Dr. Kasakala has been one of us for many, many years. He was a medical doctor who did clinical psychologist, who we've worked together for a long time, set up the Daystar Clinical Psychology Department, clinical psychology counseling, and was also one of us in the Department of Psychiatry, University of Nairobi, and we're going to miss him a lot. It's complicated, it's stressful, and I don't want to say too much about it, but I thought, given that we have so many psychologists and mental health providers in this, and doctors, let's just do 1 minute of silence, please, just to remember him and wish his family well. Thank you very much, everybody, for allowing me this moment to pay respects to a person who I mentored, who also became a colleague, who became a friend, and counted among one of my good friends. So, and let's continue from there. That one of the things, of course, we've learned to do is to leave our new norms with our masks. They're still very important. Please don't give up on the masks. Sometimes we're working from home, sometimes we're working on site. We continue to wash our hands. That's a good habit anyway. We don't want to drop it, okay? Some people say one of the good things is that we have seen a drop in the gastroenteritis in children because mothers are washing their hands like they never did before. So these are good habits. Now we've been vaccinated, and if you haven't, please make sure you do get vaccinated twice, and boosted, go and get boosted as well, so that you protect yourself and you protect the other. It's about self-protection and protection of the others. Some people say, yeah, we've seen people getting sick, they were vaccinated. Yes, we don't say that you won't get sick because you're vaccinated, but we say that your chances of getting a very mild form of illness is very high if you're vaccinated and you've been boosted. And chances are you may not even notice. So some of the other things we've done are not so positive socially. We encourage social contact, but we're still concerned about shaking hands, hugging each other, which brings us close to each other as social beings. We try to stand apart, and we don't enjoy the social places like the way we used to. I know there's no curfew now, and we can go out, but there's some sort of reservation, and we want to be careful. The fear is never too far. We try, and in some ways it will never be the same again. There was somebody showing a baby who was walking around touching every button, and this baby is born in COVID, think that she would touch and then put her hand under like sanitizer. This COVID has changed us in many ways and has changed the world in which we live. But we are survivors. The human being is resilient. We have a lot of resilience. We survive. So experiences, expected fear, anxiety, burnout, depression, vicarious trauma, for those who are working in the front line. And we still have people working in the front line. We still have caregivers who are out there. And so this is the experience we have. A bit of concentration on burnout, as we care for others, even when we work as mental health providers, as psychiatrists, as psychologists, or even as doctors, is that burnout can be very real. And feelings of burnout. Burnout comes with feelings of extreme exhaustion, feeling of being overwhelmed, and it comes with sadness, depression, apathy. People get easily frustrated, they snap, but they blame others, irritable. And sometimes you get that lacking of feelings indifferent, It's like if there's there are doctors here, KMA doctors, you remember when you did internship and you are so overwhelmed, you were burnt out, you stop feeling. People are dying around you, stop feeling. That is burnout. And it's not a good thing, You sort of start getting isolated, disconnected from others. There's the problem, some people develop poor self-care, hygiene. They feel tired, overwhelmed. You feel sometimes like a failure, and that nothing you can do will help you. First, you're so enthusiastic, you're there, now you're there, you graduated, you're a psychologist, you can start practicing. And then things don't go the way you expected. You're trying hard, and sometimes there's so much to be done. There's so much to be done. We know that the workforce is not very big here, so we do get overwhelmed. And sometimes you look for the thing to help you out. Sometimes a chemical substance like alcohol, sometimes other drugs like some people tend to have problems with sleep, so they reach out to sedatives, benzos. And then you have the ones who are working so direct with people who are traumatized, so direct, like those who are doing front line, who have to see relatives, those people who just lost. The trauma becomes too much. And it is possible that you can get vicarious trauma, also called secondary traumatic stress. And it happens that you have experiences of excessively worrying or fear, feeling as if something bad, that anticipation bad is going to happen. You're easily startled, just like somebody who is having a post-traumatic stress or acute stress disorder. You have physiological signs of stress, racing heart. You have nightmares, recurrent thoughts. When COVID started, I think most of 2020 and a bit of 2021 and bit of 20, we were offering group sessions, telephone group sessions with frontline workers, and some of these are some of the things they said. At night, I can't sleep because I see these images. I see these relatives coming. I see the fear in their eyes. I look at this person trying to breathe and he can't breathe, and he knows he's dying, and he knows, this kind of images, and the trauma of others becomes your trauma. So one big question has been, who is caring for the caregivers? Physicians, heal yourself, psychologists, you have to to start thinking about yourself, how, because if you're burnt out in the end, you are not able to do that which you're supposed to do and that which you were trained to do. Burnout also leads to a lot of medical errors. It leads to that non-caring. It doesn't matter. And so you really need to care for yourself to be able to work efficiently and effectively. So, to recognize also the signs, because it could be not yourself, but your colleagues, family members, and take action. If you recognize that somebody is getting burnout, it's good to speak to them and see, what can I do for them? What can be done? Where can they go? Take action even before it happens through positive lifestyle. And this is what the session today is about. It's not about waiting until you're burnt out to say, okay, that lecture was good, but it's not really about me. I don't have burnout. I don't feel stressed. I'm not a frontline worker, or I'm not doing this. So it's about learning to take care of yourself before you get there. It is a way, cultivating a way of life. Okay. So some coping strategies that we've been encouraging people to do during COVID also, when things were really bad, now they're better, and we hope they continue, is to take breaks from watching, reading, or listening to news stories and social media that repeats the same messages every day, the same catastrophic messages. Give yourself a break, okay? We are lucky that the infodemic has gone down. We are hearing less of that, but sometimes it can be overwhelming. The other one is to take care of your body, deep breaths, those, psychologists know about diaphragmatic breathing, progressive muscular relaxations, and stretching and meditation and prayer for those who tend to prayer. The other one is about eating healthy, well balanced, drink plenty of clean water, exercise regularly, indoors or outdoors, whatever is available to you. Outdoors best because of fresh air and sunlight, but it is whatever you can. at least once a week, even if you're not able to, try and get out into a place where there's good sunshine and fresh air. Try to get plenty of sleep and avoid the alcohol and drugs, including hypnotics, as a solution to stress. Don't drink because you're stressed. You can meet a group of friends and enjoy a drink. You can meet with your partner and have a drink. But if you're doing it because you're stressed, then you're saying that alcohol is treatment for stress. And that it is not. That is, you're stepping on a precarious road. Make time to unwind, connect with others, okay? Now we are open to meeting others, even if we don't get too close, and you don't have to meet them indoors. So the concept of self-care, which I want to introduce, was based on the WHO, defined as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disabilities with or without support of a healthcare provider. So it's something that everybody can do, whether you're a provider, bring it out to your community, bring it out to your people, tell them self-care. Self-care is to be promoted, even in schools, okay? Even in younger people. And it is a concept that looks at promoting a healthy lifestyle on the understanding that a healthy lifestyle is key to prevention of most non-communicable diseases, of which mental diseases is one of them. And this has become, of course, particularly important at this COVID-19, where we are told that comorbidity is bad, not good, okay? So the risk of developing non-communicable diseases is raised and particularly common when you don't take care of yourself, okay? Psychiatric disorders, depression, anxiety, substance use disorders, like I've explained, where you think, where people start using substances to solve their problem. This is the main three. The self-care focuses on three areas. One is nutritious diet. The other one is a physical activity and emotional health, okay? Nutritious diet, very important, okay? So one thing about our lifestyle is that we are in sort of in transition. We are progressing away from, particularly in the urban centers in Kenya, we are in that transition where people are going into unhealthy foods because you can afford it, okay? You can afford to buy chips, you can afford to buy a chicken, the one that drips and rolls and, tastes nice, sausages, you can afford these things. You don't have to eat domas and guaches and the sukuma. You can afford unhealthy foods, which are expensive. You can forget to indulge in chocolate and, all the things that if you go to some of our rural villages, some of the problems we're having in some of our urban centers with overweight, and it's not such a big thing. Some of our rural counties have a serious problem, like Central Province. They eat a lot of bread and sodas and Coke and the hot chocolate with a lot of sugar in it, and we can afford it, so it has the impact of raising then the prevalence of diabetes. It's a serious thing to levels which are very high, hypertension, diabetes, whatever. So nutritious food, and we all know them, so I don't even have to tell you. And I don't even have to tell you this, like somebody say, you're telling us, if you don't tell us the same things we all know. It's not that, it's about the practice. What we know, but we don't practice. So I'm not going to tell you anything about those things there, but it is the practice of it. And what we did at sometime in 2020 is to develop, and 2021 is to adopt the concept of self-care, to develop a tracking form that motivates the individual to integrate self-care habits into their daily life so that it becomes a part of it, becomes so your norm, you know. And we've used it with the frontline workers at Kenish, KU, and we've received very positive feedback. We also did it with students. Sometimes we adjusted it to fit their language. And you know, that's why I would like to share this with you. You don't have to be stressed to use this. It is a lifestyle that helps you to prevent yourself from getting stressed, depressed, anxiety, and other non-communicable. And you develop an accountability by tracking yourself and chatting. Okay, so I'm going to because this is kind of really small, I could sort of stop sharing so that I show you. Well, maybe it just, I don't think you'll be able to read what is written here. So allow me to stop sharing and then open that, so that we can have a look at. That's very good because I can't find it. Okay. So that I can project a bigger version. So I put it a bit big, like so, like so, like so. And then I project it again so that you see that bigger version. So let's see, it's here. And so basically, this is the form. And the form is like, I mean, you can put your name. It's yours for your use, so you don't have to. But here you put the month. For example, now you would put February, and the dates. Every page is 1 week. Okay, you have your dates here from this to this. Like today would be usually you can start on Monday to Sunday, or you can start on Sunday to Saturday, depending on how you see your week. But this one usually starts on Monday. So one thing you need to do is sleep. Sleep is one of the most important behavior habits, physiological as well, that you need to keep healthy. It's been found that poor sleep pattern, inadequate sleep also contributes to poor mental health and even non-communicable diseases like diabetes. So that's one you want to take care of. So the whole idea is to have enough hours of sleep. So, and to always have a pattern that is the same so that your head knows it. Wake up time, sleep time. Of course, we know that some people work on shifts and this becomes very difficult. And I realized this when we were working with the nurses because of their shift system. It doesn't always work very well for doctors as well, nurses, people who work shift hours. But you try your best. Set your sleeping time, wake up time. You might decide, for example, I want to wake up every day at 6. So you put 6 here. Then you want to sleep every day at 11 or something like that. The idea is to get at least 7 hours of sleep. Some people say they do well on 6. I think the recommended is up to 7, from 7. So what you would do is put a tick for yourself here. When you wake up at 6, you put a tick. When you sleep at 12 here, you don't put a tick. Then you go to Tuesday and so on. So you give yourself a tick. And then the other one is to stay connected. Call a friend, meet in open spaces, or call a family, meet in open spaces. Then for every day of the week, then you can give yourself a tick. Of course, there are some days that you will not, but and remember that calling somebody is not just good for you, it's also good for them, okay? Then think about at least 2 hobbies, things that you do that are not related to your profession or your career. So don't tell me that your hobby is reading and then you're reading a textbook of psychology. That is part of your professional career. Take something else if you like reading. So people have different, some even combine, and like I presented the other time, and Dr. Njenga was pointed out that yes, some of these things are combinable. Your hobby can be walking, and at the same time, the same walking will be part of your exercise. And it will also be, you've heard of mindfulness walking. It might be part of your well-being meditation practice if you're doing mindfulness walking. So anyway, so you have your 2 hobbies. It's up to you to decide. Please try to make sure that the hobby are not digital, social media, Facebook, WhatsApp, because you're going to be getting a lot of mess from there, this and that, and Facebook, and I'll be posting my Facebook things, and you're there thinking this is a hobby, and I'm saying how I had a terrible day. This happened. Have you helped yourself? Digital hobby, and take care about that. Some people like to watch movies. It's okay, I guess, but some movies leave you more depressed than feeling rested and relaxed. Yes, okay. Horror movies, whatever. So think about it. What hobby can you cultivate? 1 or 2. Then you give yourself ticks. Then there's this worry window or problem solving time. It's a worry window, really. WHO calls it a worry window. Our students like to call it problem solving time. They don't say, we don't want a worry window. It is a time when you say, if you have so many things going on, set aside time to say, okay, that's when I will deal with it. Okay. Just an hour. It doesn't have to be an hour. It can be 15 minutes, 20. You can also have write it down. Sometimes things that sound like they're running in your head as if it's a clockwork. When they are put on paper, they look more solvable, just, is it something I can do something about? Yes. If so, what do I want to do about it? If not, just let it be there on paper. Maybe when I think about a solution, I'll come back. Then it stops going round your head like clockwork. Recently, like yesterday, somebody called it brain dumping. Like when there are so many things going on, you're stressed, you feel overwhelmed, brain dumping. I like that. Piece of paper, write all those things going on in your head, then sort them out. What does this belong? Which one is more urgent? Which do I have to deal with immediately now? Which one is urgent in terms of time? Like if I don't pay my electricity bill, they're going to disconnect me. That's urgent, So it has a time limit. So there are many strategies out there of dealing with all those things that go around your head like clockwork. Some people find that the worst, this kind of thing keeps you awake at night. Like if you're not sleeping, it's because it's doang. You even solve them and of course the solutions are hopeless because you're sleeping. So it's just a question of setting aside time, if you like. If this is something that, all these things may not be valid for everybody. Some people don't have this kind of issue with worries or needing a problem solving time or a brain dumping hour, but some do. Well-being practices, under that we have spirituality, which we call connection with the higher being. It's up to you how you do it. It's not about join this religion or that one or the other one. do this. It's about your connection with a higher being. And how you do it, that's you. Some people do it through meditation. Some do it through prayer. Some do it through reading the Bible. Some do it through mindfulness. Just have a time. And like you said, you can also connect it to another activity. People who do mindfulness walking, they walk outside in the open, in the forest or somewhere in nature, and then they use that time for mindfulness. So other people do other things. So you can connect it with other things. Some say, I need just this special time just for that. Okay. Exercise is so important. You know, again, remember that thing about eating, what you're eating, and exercise is important. I want to tell you something. If you want to grow old walking on your own 2 feet comfortably, you have to invest now in your body. It is just like any bank. You put money in the bank so that when you you save money, so that when you're no longer able to make money, you can have comfortable life with your money. You want to be comfortable walking with your own 2 legs comfortably. You know those old people you see walking around, like even if they have a mkwanju, and then you're looking, how old is that person? You're thinking, 80, then you hear they're 85 and you're like, oh my God, you know, you have to invest now while you're young. It's really absolutely important. And I tell you this, if you've lived with if you have one of your parents who is growing old and overweight, like my mom, then you know how important it is. Invest now, because walking becomes very difficult, very difficult. So exercise. Then you have your gratitude journal. We used to, students always want to, what is gratitude thing? I said, you know, most Kenyans, majority of Kenyans, a big number of Kenyans are Christians. They've all come across a song called Count Your Blessings. That's what it is. Studies have even shown that people tend a lot of time to indulge in negative thinking rather than in positive. Gratitude journal is about indulging in positive things, the good things that have happened to you. Just that, you know, being able to breathe freely every day. The air goes in, the air goes out, and you're not struggling. That is something to be grateful for. To be grateful that you have friends. There's somebody you met today and you had a good laugh, you know, and you're grateful. You're grateful. You can put it, I'm grateful for this. You can count it as a blessing. You can say, thank you, God, if you're tend that way, or just grateful. Gratitude journal is a journal you keep where you think about at least 3 things that you're grateful for on any particular day, or 1 or 2. And try and do it. You can do it. Some people do it in the morning. Some do it last thing at night. I do it. My last gratitude journal is, I've been keeping a gratitude journal for 3 years, and I do it at night. And every night I write 3 things. Sometimes it's always the same thing. I'm grateful that I'm healthy. I'm grateful for my life. You know, it doesn't have to be anything exotic. I'm grateful that, you know, whatever, I had this opportunity to speak with colleagues about something that is dear to me, you know. So charity, this one, I never had this one initially until we had a presentation with Dr. Kigamwa, and he told me, yeah, that one has to be there. And I added it. And after that, I have read and found that charity, giving, doing good to others without expecting in return, is very good for us. And during the last presentation, we even got a contribution, a reference from Dr. Jenga about this, from Richard Dawkins, author of several books. And maybe I just put it on the chart, the selfish gene as a thing of human survival, you know, doing to others. And now, if I still have a little time, I'll show a caption of a thing that was going through WhatsApp on giving. doing to others without expecting in return, because I found it really spoke to me. Now, number 7 is eat at least 1 portion of fresh fruits, fresh vegetables. I know we worry a little bit because we don't know where these things are growing and what, but yeah, that's our reality, isn't it, sometimes? So try and eat some fresh fruits and some fresh veggies every day. Drink plenty of fresh water. Fresh water is not juice, it is not soda. You say, oh, I'm counting, I drank a lot of liquids today because I took packeted juice. You know, these things have sugar, they have additives, they have plenty of sugars, by the way. So why don't you go for water, fresh water? You don't even have to buy it. Just boil it, you know. If you're worried about the cans of water, because sometimes we don't know, sometimes it has too much chlorine, sometimes it has too little, just boil it. Just boil it. You don't have to buy it, you know. Fresh water. Try to avoid sodas, the Cokes, the Fantas. These things have a lot of sugar and sugar juices. And of course, alcohol. When we had this, we said it is a thing where you get a score if you don't do. And if you do, you don't. So the day you take a Coke, you don't get a score. The day you take your favorite alcohol, you don't get a score. I'm not like beating alcohol completely. I mean, I drink. And I'm just saying that there's not something to get a score for. That's all. Yeah. And then you have, at the end of the day, you have your daily scores each, and then you can say, this week, this is my average score. This is my what? Total number of scores you can get on this is, I think, 8 or something. But remember, again, you're not competing with anybody, you're just competing with yourself. So allow me to stop sharing so that I'm able to share that other little video, which I found so nice. I've looked at it several times, just makes me happy. So that, where did I save it? Okay. Wait. Stop. I want to pause so that I'm able to project it. It's always some story. Projecting a video, share screen. I did it last time and it worked. So I'm knowing and thinking it's gonna work again. There you go. I hope the volume is good. Let's start from the beginning.
Your volume, Dr. Matha, Professor, you need to go up a bit.
Okay. Again, I hope that helps.
Is how simple it is to make people feel good.
If it can even go higher, the better.
Okay.
And a guy with his backpack, acts of kindness, acts of generosity is how simple it is to make people feel good. I was walking down the streets of New York City, and a guy walking in front of me, his backpack opened and a bunch of paper fell out on the street. I didn't think much of it. I bent down, I gathered up the papers, handed them back to him, and pointed out that his bag had opened. Now, in our bodies, there's a chemical called oxytocin. Oxytocin is responsible for all the warm and fuzzies, unicorns and rainbows. It's responsible for all the warm feelings and connectedness we have with each other. Friendship, love. Huge amounts of oxytocin surge through a woman's body as she gives birth. This is what is responsible for the mother-child bond. Oxytocin binds human beings. There are many ways to get oxytocin. One of them is acts of kindness and acts of generosity. It feels good when we do something nice for someone. It feels good when someone does something nice for us. On this particular day, I did something for someone with no expectation of anything in return. I got a little surge of oxytocin. I felt good. He turned to me and he said, "Thank you." It feels nice when someone does something for us with no expectation of anything in return. He felt good. I walked to the end of the street. I'm waiting to cross the street. And a total stranger who happened to be standing next to me said, "I saw what you did back there. That was really cool." As it turns out, witnessing an act of generosity releases oxytocin, and he felt good. And the best part about oxytocin is the more oxytocin we have in our bodies, the more generous we become. It is Mother Nature's way of trying desperately to get us to look after each other. I can guarantee you that that man who witnessed what I did something nice for somebody that day simply because he saw someone do something nice for somebody that day. So what if we commit to do something nice for someone with no expectation of anything in return? Imagine what happens at work. Imagine what happens at home. Imagine what happens with our friends. But it must be genuine.
Okay, that's my little gift for you today. Let me escape. Go back to, let me stop sharing and go back to the slide. Okay, so now we're back to the slides. We finished with the self-care form. And so I'm just about to wind up, but I want to tell you something about accountability. Now, accountability helps us. We defined as responsible behavior, doing what you said you would do when you said you would do it. And maybe this is a very important thing about this presentation, because like I said, you do know all these things that you're supposed to know about self-care, but are you able to do them? And accountability is, you said you would do it when you said you would do it, okay? Now, it has been found that when you share loudly, when you verbalize to others, it's just like in addiction. When you verbalize, you say, "I'm going to stop." It's a powerful tool. So it helps to have an accountability partner, somebody who helps you to keep your commitment, who you say, "Look, so and so, I want you to help me in this. This is what I want to do to improve myself, for my self-care, for my well-being. This is what I want to be doing every week. Can you be checking with me?" Of course, it helps if that person is also committed to doing the same thing. That means you're doing the same thing. Like it is like those people who count steps and they have, like you're on your phone and you have somebody else with the same and you check each other out. That is accountability. It helps us when we know that we're doing this and we're going to say to people, this is what I did. Others, accountability groups, like when we did these forms, we've been working with groups of about 6, sometimes 4 sort of providers. And so people would do during the week and check up on each other once a week or something like that. Of course, didn't always work very well, but it always helped you to do, even if you score only one small item, you don't have to score everything all the time, 100%. Even when you're working in an accountability group, you are always not competing with the others. It's always with yourself, okay? So you can form a self-care accountability group. You can meet online now that meetings are open and it's safer. You can also say once a week, we're gonna meet and have a tea or something and check how we are doing, okay? That's a self-care accountability group. You will be hitting very many birds with one stone, because you might even decide to meet at Karura Forest, and then you take a walk and then you sit, and then you check each other. How are you doing? You've done your steps, you've done your socio, you might even do your mindfulness at the same time, okay? So again, it is not about winning. It is part of being a race, being an accountability but it's not, I'm going to win this time, I'm the winner of this, I'm going to be better than so on. It's about being part of the race, not about winning. Okay, it's not school, it's not marks. Okay, so in summary, COVID-19 has changed the way we live, work, and socialize. It has generated a lot of anxiety and stress. Healthcare providers everywhere experiencing burnouts, particularly those who work in the front line. And it is time to rethink new ways to fight back and to stay safe and stay healthy, and integrate self-care habits into your and your family's lifestyle, and track yourself. Be accountable to yourself. Be part of an accountability group. If you don't, get an accountability partner, or just your forms. Print your forms, put them together. If you're digital, explore how to do this digitally. And that is all. Thank you so much for giving me time so that I can put it in my gratitude, as I'm grateful that I had a chance to share something that is close to my heart with my colleagues. So thank you very much. And I'm open to questions and comments. Back to you, moderator. Let me stop sharing.
Thank you so much. Thank you so much, Prof. So I'm looking at the Q&A.
Yeah.
And I think you're able to access the same. Isabella Orege says, life has become so difficult for most people. I think this is more of a comment, such that making enough time for activities that stimulate physical and mental health is a tall order. Yes, and then Philip Tonui, I do not know whether this is a question, but he says, safe and satisfying sexual activity does not contribute to the daily score. So I'm thinking it was a question, it just missed the question mark. Or does safe
it can be a comment?
Yes.
Yeah. It's a very, very good comment. Safe and satisfying sexual activity should actually contribute. WHO doesn't have it. Maybe it put at a score, but you know, these forms are adjustable. You can add it to yours. Like there's another program which I do, which has 15 categories of things, you know, and one of the categories is about sexual relationships. So definitely, Philip Tonui, please. A satisfying sexual life is underrated. Let me put it that way. So you add it to your, I'll put out the forms, you can get it, add it to your form, anybody who wants to. Thank you for pointing it out.
So thank you, Prof. I think there were, and that's on the charts, there were questions about you sharing the tracker, but you've already let us know that you'll be sharing the tracker. Yeah, so I think the same can be sent to people as they receive their CPD points, so that's okay. A lot of thanks for your presentation from, of course, the participants. I don't know that you have any other comment because now what's coming out is asante, asante, asante.
I know life has become so difficult for most people, such that making enough time for activities, it doesn't, and mental health is a tall order. I'm not quite sure whether this means that it's going to be difficult to have time. But what I just want to encourage you is take what you can and try to make a little time for yourself. It's about you. You know, if you get sick, if you get sick, you get depressed, or you get whatever it is, then you will not be useful to us and all those people who demand your time. So you need to keep healthy. You need to take time for yourself no matter what. Let not the world crush you with the demands that they have for you. Okay, like you said, like Dr. Jenga said, some of these things can be combined. They can be put together. You can do them together. I promised to put the name of the book that Dr. Jenga referred us to, Forgiving, Richard Dawkins, I think. And the book is called The Selfish Chain. It's about human survival. I think he did a lot on evolutionary. So
So thank you so much, Prof,
okay.
For actually taking the time and sharing this with us, because it's very important. Even though, of course, we seem to be winning this war with the pandemic, we still need to take care of ourselves as we take care of others. So, kabisa. And also to our participants, thank you for staying tuned, for asking questions, and for making comments and making this session interactive.
There's a question.
Next to speak to us about the call center. Oh, sorry.
There's one question about whether the tracker is Sindu Musao is asking whether we can share. This is not patented. Give it to your friends, to your patients, just describe what it, but most important, tell them they can modify it to fit themselves. It's really open for you to use and give out, okay? No problem.
Thank you. So Peter, kindly project
Check your internet that is breaking.
Call center numbers.
Liz, can you have it? Are you hearing that she's breaking, or is it mine?
Yes, Ohad,
Before we,
has a problem.
It is her who is having a problem.
Oh, sorry.
Yes, I think your internet is breaking, Ohad. And I think there's a question on the Q&A.
Huh?
Yes, your internet is breaking, and there's a question on the Q&A.
Oh, okay.
Maybe I can
read it, please.
Yeah. It is, how can one identify and enroll back the effects of destructive coping mechanisms such as alcohol abuse, etc.?
How can one do what? Sorry, how
can one roll back the effects of destructive coping mechanisms such as alcohol abuse, etc.?
Yes. How one can roll back. That depends on how the alcohol abuse is. You know, alcohol use disorders have different grades of severity, and the people have different capacities of coping alone. I would suggest that one way to do it is to consult somebody else, a specialist. We have a lot of psychologists, psychiatrists here. You can whatever. You can also do your self-assessment, like an audit, and see how severe is it. Is it something that I can do alone, or is it something that that needs self? There's some people who have that capacity to say, okay, from today on, I'm not gonna take any more alcohol, and they manage. Okay, there are others who say, I need help. So it actually depends on the severity. And but it is true that negative coping strategies are hard. Habits are hard to break. Sometimes it helps to replace the bad habit with another, so that at that time when you are into that, you replace. Like one of my bad habits is taking a nap in the afternoon, or anytime between. I get so sleepy between 3, 4, 5. So if I'm a place where there's a bed, I can even crawl into a hedge and fall asleep or something. So what I do is, that is the time that I try to walk. So I just try to overlay it with something that contradicts. You can't sleep and walk, you know? So even if I'm in my office and I'm like, oh my God, then I wake up, I walk to the post office, I look for letters, I do something. So one way is to put another habit on that other one. but it depends on the severity of the problem. Like with alcohol, if it's severe, you may need help. Thank you. I have already put the book. It's a classic, actually. It's an old book. It's a classic. It's called The Selfish Gene. It's one by Richard Dawkins, which was recommended for, if you are interested in reading a bit around that story about giving and what it means to the society, to the human race. And so if you still want it, I'll write again. If it's called, it's Richard Dawkins. I found some interesting thing that Richard Dawkins was born in Nairobi in 19, I don't know, 20 what. It's called The Selfish. I don't even know whether it's available, but I know it's available in Amazon, but I haven't seen it in the, I haven't seen it in the bookshops, but it might be available in the libraries because it's sort of a classic psychology book, evolutionary psychology. Okay. Anything else that I need to?
I don't know if we have Ohas back. Dr. Ohas, are you back?
She's muted.
I don't know whether you can hear me.
Yes, we can.
Are you hearing me well, or?
We can hear you well
very
now.
well. Oh, you can. Oh, thank you. Okay. So I was saying that, oh, asante sana, Prof. I hope that was well heard, at least. And we wanted to talk about the call center. So if Peter could kindly project the numbers for us so that Dr. Liz can walk us through that. Thank you.
Thank you, Dr. Haas. I just want to make a small comment from Dr. Malai's presentation, from Professor Malai's presentation. One of her last comments, if your body will take it for you, and sometimes the body does that for us at the craziest of times, like when we are really, really busy, when we really can't afford to take a break, but the body fuses for throwing us into burnout, where we have to take breaks that can run from months to years, and there to work. So Peter, please project for us care workers. For those of us who know about it or who have known about it, now being projected on the screen, please pinch out so you can be able to see the numbers, possibly write them down. And if at any point you need somebody to talk to as a healthcare worker, please call us. The call center is open every day between 6 a.m. and 10 p.m. And the people who receive our calls are healthcare workers like us. So we have psychiatric clinical that as healthcare workers with center of healthcare workers. The call center have a member of family service.
I don't know whether I'm the only one who wasn't getting Dr. Liz.
She's breaking as well. Her internet
Oh,
she's
breaking. Okay.
Yeah, she's breaking. Her internet just, I think she has even dropped off. Her internet was
I'm
breaking.
here.
Oh, you're
Yeah.
there.
I'm here
Okay.
now. So
All right.
I don't know how much you had, but I'm just encouraging us to use these numbers, including our families. Any member of your family who needs psychological support, please also give them the numbers to call us, and we will be able to provide that support. Thank you very much. Thank you very much, Prof. Madai, and sorry for the very short notice request to give us this presentation. We really, really appreciate it. Thank you. Back to you, Dr. Ha.
You're welcome.
Right. Asante sana, Dr. Liz, and of course to our participants, our speaker, and our panelists. Tunasema asante sana. We will see you again next Tuesday, and good night to you all. Thank you.
Good night.
Goodbye. Thank you. Bye bye, everyone.